So we can dive in. But first I will introduce the organization that I am retired from, and that's the DuPage Federation on Human Services Reform. And the Federation is a nonprofit, non-governmental planning organization. And we look at what is happening in the health and human service system and what needs to be improved. And we work hard to try to make that happen. The three big programs that we have are community planning and data analysis, training and technical assistance, which is this kind of thing, and the Language Access Resource Center, where we help organizations that are dealing with increased numbers of folks who don't speak English. We have coming back to training and technical assistance, we have a program called Making the Connection, which is intended for health and human service professionals who are confused by all the various acronyms and public benefit programs, and we try to straighten that out for them. So today we will first start with a general overview of Medicare. We'll look at who's eligible, what are the various parts of Medicare. Oops, that one jumped too soon, sorry. Who's eligible for it, what's covered under Part A and Part B, what's the Medicare supplement insurance landscape, what does that look like? Then when can you enroll in Medicare and what can you do in the open enrollment period that we're in right now? And we'll talk a little bit about Medicare assistance programs where financial assistance is available for folks with low income situations. And then we'll also talk about how Part D interacts with all of this. So I'm hoping very much we can stay awake for that. Okay, so here is a really helpful chart. So let me go back to Medicare, which initially started in 1965 under the federal government's war on poverty at the time. And at that time, seniors who had health insurance generally lost it when they retired. And there were large numbers of seniors who had no health care coverage at all. And to their credit, Congress and the president at the time, Lyndon Johnson, decided to take that problem on. And they started Medicaid and Medicare, two different programs, which launched in 1965. And at that time, there was Part A and Part B. Part A covered hospital care, and Part B covered doctor visits and labs, outpatient things that happened outside the hospital. Now, both of these programs have had massive change years, and it's important always to keep up with the changes. One of those changes was the addition of Medicare Advantage plans, which are referred to as Part C. And those are HMO or PPO type programs where if you had managed care during your working years, you're familiar with a network and selection of a primary care doc who usually, not always, has to coordinate all of your specialty care. And many of these Part C plans also include drug coverage. And they also, so the drug coverage, until about 2006, there was no drug coverage in Medicare. And as prescription drugs got more and more expensive, that became a bigger and bigger problem for folks that were on Medicare. And so Congress and the president, in this case it was and developed this very, in my humble opinion at the time, was convoluted plan. Is somebody driving this? Because I'd rather that we didn't do that. Let me see if I can take control. Okay, I'm coming back to where I was. Okay, so then we got this very complicated Part D. So the first thing to think about is how you want to get your Medicare coverage. Do you want to stick with original Medicare, or do you want a one-stop shop and have a Part C plan, which may be less expensive, but also comes with more, more pre-authorization and more complications? So this is the first thing to consider. Then, so now we'll talk about who's eligible for Medicare. And the first group that we think about are people who are age 65 and older. And that is the group that was originally eligible for Medicare and continues to be eligible for Medicare. Then later on, Congress added coverage for people who were receiving Social Security disability benefits for 24 months or longer. Then they also added people with end-stage renal disease, kidney failure, who might need a transplant or long-term dialysis. And I'm sorry, this is jumping around, Ashley. If you can make it stop, that'd be nice. Then they also, I'm sorry?
We can, if you just hit, there's a button at the top there, Candace, it says private view, or it should say only view. That should allow you to only be the one toggling back and forth.
Okay, I don't see that.
Okay.
But I'll try. If I see it, I will. Hold on. Maybe that's it. Okay, very good. I think maybe I solved that problem. Thank you, Ashley. Okay, so then the last group that Congress added to Medicare are people with Lou Gehrig's disease or amyotrophic lateral sclerosis. And we had the ALS challenge a few summers ago, and you may remember a little bit about that condition. So the two big groups then are people age 65 or older and younger people who are receiving Social Security disability benefits for a period of 24 months or longer. And that may cover folks that receive treatment at the cancer center, because if they qualified for disability benefits due to their cancer diagnosis, they may be able to receive Medicare. I'm thinking of a gentleman that I knew a few years ago who was hiking in the mountains, and he tripped over a tree root and fell and broke his neck and became a quadriplegic. And so we helped with his initial application for disability benefits. And then after 24 months, they sent him a Medicare card. So that's an example of that. Then we'll talk about Medicare Part A. And that Part A, remember, is hospitalization. And so it covers inpatient care in a hospital. So, for example, a couple of years ago when I had one of my knees replaced, actually I had both knees replaced, one at age 64 and the other at age 65, and Medicare covered the second one. And they pay hospitals a flat rate per admission. So if you get a diagnosis of knee replacement, the Medicare pays the hospital a flat rate. And if they are able to provide the care for less than that flat rate, they make a little bit of money. And if you have a readmission or you have complications, then they may lose money. So the hospital does take on some risk. Then the second part of Part A is they cover skilled nursing facility care. And some people think that means that if you get very old and need custodial care and go into a nursing home, that Medicare will pay. This is not true. And if you don't remember anything else, remember this. They provide skilled nursing care, not custodial care, for a limited period of time. And that's if you have a skilled nursing need and you have been in a hospital as an admitted inpatient for at least 3 nights. And I'm thinking of a situation where, and we read about this sometimes in the press, that sometimes hospitals will keep you for observation after an emergency room visit, and they'll keep you for observation for several days sometimes. And folks can think that they have been admitted, but they really haven't been. And so that's why I put that red flag up, because if you're hoping to have Medicare pay for your nursing home services, it's critically important that you know for sure that you had an inpatient admission. And so if you go to a nursing home after a hospitalization, days 1 to 20 are covered at 100%, and then days 21 through 100 are covered at 80%. Then Medicare Part A will also cover hospice care. We had experience with that. I'm going to tell you all my family stories in this presentation, so I hope you find the examples helpful. My mother was age 96 and had a massive stroke, and the doctors told us she was going to pass away and advised us to call in hospice, which we did. And so that got covered at 100%. There was no cost to the family for hospice care. Then the last major category of services that Medicare Part A provides are home health services. And those, I refer to those as services to keep you out of the hospital. So that can be such things as nursing care, home health aid services, and sometimes there are things like speech therapy and physical therapy at home so that you don't have to go to the hospital. Okay, I'm trying to move us here. So then Part A, the costs of Part A, normally there is no premium. If either you or your spouse worked at least 10 years in covered employment, then you are eligible to get Part A at no cost. And that's because out of every paycheck, we have contributed funds to Medicare to build up this benefit. There are some people who don't qualify for free Part A if neither the person nor their spouse had coverage. Then the monthly cost is $278 in 2023 if you worked at least 5 years in covered employment, and $506 a month if you did not even have the 5 years of coverage. Then there is also an annual deductible of $1,600 in 2023. And so days 1 to 60 of hospitalization, and almost nobody gets hospitalized for that many days anymore, but that's covered at 100%. Then you can see days 61 to 90 are covered with a $400 a day copay. And then days 91 to 150 have yet a larger copayment. Then Medicare Part B covers medically necessary services to diagnose or treat an actual medical condition. Excuse me, and that includes outpatient services, doctor visits, physical therapy, labs, imaging, outpatient surgeries, etc., durable medical equipment, mental health services, and some very limited outpatient drugs. But chemotherapy is one of those, so that gets covered under Part B. Then Medicare Part B also covers preventive services, which is healthcare to prevent illness or detect it at an early stage. That's a relatively recent addition to Medicare. And I can remember years ago, Medicare wouldn't cover things like a physical exam. And now it does. Now it does. And tests like, a pap test or colonoscopy or those kinds of things. Those are preventive services. Cost of Part B in 2023. And that could be higher depending on your income. There's a program called Irma, and that's a surcharge that people with income above a certain level must pay in addition to their Medicare Part B and Part D premiums. The Social Security Administration determines who pays this surcharge that was reported on your tax return 2 years prior. So for one, and depending on that, it can be quite a bit higher. Now, Part B has its own annual deductible of $226 in 2023. And then they cover 80% of the approved cost of services, and the patient is or his or her supplement is responsible for the remaining 20%. And sometimes I joke a little bit that Medicare covers 80% of what they think the service should have cost, and not what the doctor is actually charging. So that what they actually pay may be quite a bit less than 80% of the total. So now the question is, how do I, so if I have heard about all this and I think Medicare is my best bet in terms of where am I going to get my health coverage, the question is, how do I enroll? And there are really 3 different periods you need to be aware of. So one is the initial enrollment period when you turn 65. Then if you should qualify for Social Security disability, when you're younger than 65, you will get an initial enrollment period after 24 months. And then there is an annual enrollment period. Sorry, I didn't mean to do that. There's an annual enrollment period, often referred to as open season, that we're in right now, and that's when you can make changes. So you may have noticed that I'm talking about age 65 when Medicare starts. Many of us, because of the changes that were made in the 1980s with Social Security, the age of eligibility for Social Security benefits has been rising. For the people who are my age, we became eligible at age 66. I have a sister who's 12 years younger than me, and she will become eligible at 67. And however, Medicare eligibility has not changed. So it used to be that you would get automatically enrolled in Medicare when you applied for Social Security at age 65. And this is no longer the case. And so even if you're still working and you're not yet receiving Social Security, you will have an ability to sign up when you turn 65. And there's a 7-month period during which you can apply. And that's starting 3 months before your 65th birthday month until 3 months after the month you turn 65. If you don't sign up during that initial enrollment period, you can have a penalty. And it's a fairly steep penalty. So that 7 months is an important thing to be aware of. Now, if you're one of the people who gets Social Security benefits before age 65, your Medicare Parts A and B will automatically start after you receive SSDI, Supplemental or Social Security Disability Income, after you've received that for 24 months. And again, you've got 3 months before the month of your 24th month and 3 months after to enroll in a supplement in Part D or a Medicare Advantage plan. Okay. And now the next question that some intelligent person will ask is, well, I'm still working at age 65. I don't need Medicare yet because I've got my employer coverage. You can delay your enrollment into Parts A and B if you have what they call creditable health insurance coverage through an employer. And so you want to check with your employer to make sure that, to determine whether or not you're required to enroll in Medicare. Many workplace policies require that you enroll in Medicare. Many individuals choose to accept the Medicare Part A benefit because that's free, and defer Part B if they're able to, in conjunction with their workplace health insurance policy. Then, if you delayed enrollment, in my case, I retired at age 68, and my husband had been still working during most of that period of time. And so that's what we did. We continued using his health insurance coverage, and I signed up for Part A when I turned 65, but mainly relied on his coverage. So then when he retired, I needed to pick up Part B because of the requirements of his retiree health insurance. And this is sounding really complicated, isn't it? But now you need your Medicare benefits, so you qualify for a special enrollment period. And there are forms that are completed to certify that you had health insurance so that you don't get a penalty and that you want your benefits to start now. So this is the graphic talking about the special enrollment period. And so that one is an 8-month period. So it's 8 months after coverage ends for Part A and after your health insurance coverage ends for Part A and B, or 63 days after the coverage ends for Part C, the Medicare Advantage plans, and Part D, and then 6 months after the coverage ends for the Medigap or Supplemental policies. And so then you can sign up for Part A, Part B, Part C, Part D, and the Medicare supplements. So the annual enrollment period is the time every year, October 15th to December 7th, which we're in right now, when you can make changes. Some of the changes you can make are to switch from traditional Medicare to the Medicare Advantage plan, or return from an Advantage plan. You can change to a different supplement if the regulations permit that particular change, or a different Medicare Advantage plan, and sign up if you're out of the initial period or special enrollment period. And there's, as we mentioned before, there's a penalty generally for that, but if you're going to be doing it, that's when you can do it. And like everyone else who has a landline these days, we are getting absolutely bombarded with phone calls from people who are selling Medicare Advantage plans. And the reason I think for that is that the Medicare Advantage plans are fairly profitable for some of them, for the insurance companies. And for whatever reason, they are aggressively marketing these plans. And you need to be very careful that you don't accidentally sign up for a plan that you don't want. So, what I do is whenever somebody calls and says they're from Medicare, I hang up on them, because my husband and I have coverage that we're happy with, and we don't want one of those Medicare Advantage plans. So that's just a sort of a word to the wise. Then here are the we're going to talk about the late enrollment penalties for Parts A and Part B. So if you do not enroll into the parts of Medicare when you are supposed to, and you didn't have creditable coverage by an employer-based plan, then you could get penalties. For Part A, it's 10% of your monthly premium for twice the number of years you could have had Medicare Part A but didn't. For example, if you waited for a year to enroll in Part A without having other coverage through your employer, you could pay the 10% penalty for 2 years. Part B is even worse, that if you don't enroll when you're first eligible for Medicare, a late enrollment penalty is added. The late enrollment penalty plus the normal premium for the rest of your life, as long as you have Medicare Part B. And that's 10% for every 12-month period when you were eligible for Part B, but you didn't enroll. So I think that's a penalty you don't want to get. And so be aware of these time frames. Then we'll dip into the Medicare supplement policies. Actually, maybe I'll go with the supplements and then come back to Part D. So the supplements are also referred to as Medigap policies. And those are the ones that cover the gaps in Medicare coverage. Remember, we talked about the deductibles, the $800 a day for days 91 to 150 and $400 a day before that, and then a $1,600 deductible for Medicare Part A. And so the supplemental policies generally cover those deductibles. And they can also pay other things like the 20% that the Part B has that you're supposed to pay, so that you can effectively have nothing out of pocket for Medicare covered services. Now, there used to be plans, and we'll get to that on the next slide. There used to be plans where you could end up with no out-of-pocket expenses at all. And the economic research says that that's not a good idea, because then people use more healthcare services than they really need. And so they phased out some of those plans. To get any supplement, you have to have Medicare Part A and Part B. And you cannot have a Medicare Advantage plan and a supplement at the same time. And if the computers figure out that you do, you'll get disenrolled from the Medicare Advantage plan. Now, one good thing that they've done is they've standardized the plans. So there's plans A through N, and they cover different amounts of the out-of-pocket expenses, and they also have different premiums. So that's an important thing to take a look at. And here's the chart that talks about that. So looking at Part A, Plan A, so that pays 100% of the Part A coinsurance, the deductible and the copayments, pays 100% of the Part B coinsurance or copayment, and you can see down the list. Does not cover the coinsurance for a skilled nursing facility or the Part A deductible. So you can see where there's the red X's, doesn't cover those. And an important thing to keep in mind for many seniors is many of us retire and then want to start traveling if we can and if COVID permits it. And so if you have a medical emergency while you're overseas, Medicare itself does not cover that. And a lot of people are surprised to find that out. In fact, I had an episode in my own family with that, where my niece was going to have a destination wedding in the Caribbean, and so many of the family members who were over 65 didn't realize that Medicare doesn't cover that, any possible medical emergency they may have. So most of the plans do provide some coverage for that, something to be aware of. So now looking at some of the other letter plans, you want to look at what coverage do you think you need and balance that against the premium on what you can afford. So here's a couple of examples. So the costs are the monthly premium, and it's generally not a terribly high amount. I can remember my mother, the one who died at age 96, she had one of these plans for a long time, and it was maybe 30 some dollars a month. And so they cover different services at different rates for a varying monthly premium. And the cost is usually only the only difference between them. So you might have 4 different or 5 different insurance companies all providing a Part A or a Part B, a supplemental plan. And the only real difference among them is going to be the cost and maybe the customer service. And so the more it covers, the higher the premium. That makes sense. Now there's another worth knowing about, and that is, how do the supplemental plans determine their premiums? One is, and they all base it on your age, but one of them, the first method is attained age. So if I took out a plan when I was 65 and now I'm 71, my premium goes up every year because I got a year older. Then there's the issue age methodology, where if you bought it at age 65, that's the age that you stick with for the rest of the time you're on that plan. And then there are a few plans that use community rating. They charge everybody the same for everybody over age 65, regardless of their age. The AARP, American Association of Retired Persons system, follows that. So it's important to know the difference, because you want to know not only how much does it cost today, but what's it going to cost down the road. So here's a couple of examples. The Medicare Supplement Plan G covers, what I've got listed here, and they do cover the foreign travel. And then here's a comparison with the Plan N, and you can see, the differences in coverage. So then the next question is going to be, what insurance company should I use? And there are over 50 insurance companies in the state of Illinois that offer Medicare supplements. And thank heavens they're standardized, because that's not true in the in the other insurance markets. I was looking at the Affordable Care Act marketplace to try to help my son sign up, and there was no standardization, and it was very difficult to compare one plan with another. So the standardized plans, the benefits are the same, although the price company. And I was very impressed with the Medicare website, which has a very helpful plan selector tool. And here's, I'm sorry, let me check with this. Okay. So I've got more about that in a couple more slides ahead. So I would encourage you, if you're looking for a supplement, to use that plan selector tool. Then the best time to get a policy is during your Medigap initial enrollment period, which is the month you turn 65 and you have both Medicare Part A and Part B. So then you have 6 months to enroll in a supplement policy. You can purchase any policy sold in your state, even if you have health problems, with no penalties. And so folks who say had received treatment for cancer before they turn 65 are really going to need to pay attention to this, so that you're signing up for your supplement during that initial enrollment period. If you're under 65 and disabled, some states do not have a mandate that you have open enrollment rights. I can remember years ago, often people under 65 on Social Security disability were unable to get a supplemental policy. And then when you turn 65, you'll get a second open enrollment period. where you can make changes if you need to. And so to enroll, contact the insurance company that you want to purchase the policy from. And you can do this over the phone or online. And it's important to look ahead because all of us, you know, my youngest sister says none of us get out of this alive. Everybody eventually comes to a period of time where they're going to die. And you want to make sure that even if you're relatively healthy today, that you select a policy that will meet your future healthcare needs, because you may have that policy for a very long time. And if you choose to change policies, you can be subjected to higher monthly premiums, wait times before the coverage starts, or even be denied coverage. In most cases, you won't have a right under federal law to change supplement policies. So you must have a specific circumstance or a guaranteed issue right, or be within your initial 6-month enrollment period. So here's the helpful resource I talked about. And this is from Medicare.gov, and it's a guide to choosing health insurance supplemental policies for people with Medicare. And the government does a great job, I think, of explaining all this. I was very, I was very, very favorably impressed with that. This just jumped away from me again. Sorry. Not sure why it keeps escaping, but it does. So this is where I was, I think. Okay. Then, okay. So now we've talked about Parts A and Part B, and we've talked about the Medicare supplements. And I don't have a lot of material in here about Part D, which is the prescription drug program, but that has the same kinds of challenges that that Parts A and Part B and the Medicare Advantage plans do. So that the government's website, which I've got listed a little bit later, is very helpful in that you want to select a plan that covers the drugs you take. Now, one of the things that the government has not yet done with Part D is they haven't prescribed a standard formulary or a list of drugs that they're all required to cover. So you want to look at the drugs that you're taking, particularly if you've got expensive drugs, and make sure that they're covered under whatever plan you select. I can remember with my mom, she was taking 2 drugs to slow the progression of dementia, and they were expensive drugs. And very few of the Part D plans covered those. So that it was hard to, the only plans that covered those were the more expensive ones. And so it was hard to find a plan that covered what she took. Okay, so now I'm going to talk about, and we're doing well on time. We'll have some time for questions and comments later on. The Medicare savings programs are to help people with low incomes who help pay need help paying their Medicare costs, the Medicare premiums and the Part A deductibles and all those other good things. So if you have low income, and we'll talk about the exact amounts in a minute, there's some real benefits for it. There's additional benefits, including you can enroll out of the usual enrollment periods. It can eliminate your Part B penalty if you have one. And there's an automatic enrollment in the Part D extra help program. That's for people with low incomes who need help with prescription drug coverage. And there are 3 main Medicare savings programs, each with different eligibility criteria. I like to call them the Congressman's Aunties programs, because I'm sure, no, I don't know that this is true. This is my own editorial opinion. I think there was some congressman's auntie who didn't get coverage the way she needed it. And so he introduced a bill and started a new program for her. I have no reason to think that's actually true, but that's how I think the world works. And so I gave a link here for more information about those if you happen to be or to have a family member who has low income. I'm thinking about a friend of our family who had he had been a small business owner most of his life and had not paid into Social Security, so that he had a very low Social Security check. And he was not taking his blood pressure medication because it cost too much. And so we got him into a Medicare savings program and a Part D program, and then he could afford his medication. So here's a flow chart that can help you figure out whether you might in paying your Part B or Part D premiums. So the first one is, are you single with, and I got to make this larger to see it, with less than $1,084 a month, or married with less than $1,400 and some dollars a month? Then you might be eligible for the Qualified Medicare Beneficiary Program, QMB. Or if you are single with less than $1,296 or $1,744 for a married couple, there's another program, and then there's a third program there. So take a look at that if you're concerned about yourself or somebody else with a with a low income. So here are two really good websites that have much more information on it than you could ever digest or understand. And the first is Medicare.gov, which is the federal Medicare website, which explains very clearly the different benefits of Medicare. And then the SSA.gov, Social Security Administration.gov website, allows you to enroll in Part A and Part B benefits. Again, a really good place to start. Then here are some other helpful websites, and I'm going to be talking about now where to get help. The Illinois Department on Aging has a program called the SHIP program, Senior Health Insurance Program, and you can get a lot of information about that on the Illinois Department on Aging website, and also information about their other programs. They have homemaker programs to help keep you in your home and not have to go into a nursing home, and that kind of thing. Then I just talked about the Social Security Administration. Then here's a website on the Part plan programs. The federal government has a ratings system for the various drug plans, and you can look up there and see what it is, because obviously you want to have a plan that is going to pay for what you need when you need it and not give you a lot of grief about it. Then I've got a couple of websites here. There are manufacturers' prescription drug patient assistance programs. If you've got a low income and you need to take an expensive drug, I'm thinking my sister, the one that's much younger than me, her husband had cancer, and he was on a drug that cost $150,000 a year. And they were able to get that, and they were not low income, but they were able to get that drug at a lower cost through one of these programs. Then there's a couple of other, particularly the National Council on Aging has two systems. One is a benefits checkup that will help you figure out what programs you might be eligible for. And then they've got another one, the Age Well Planner. The benefits checkup, I've actually had quite a bit of experience with it. And in each, and I think I know something about public benefits. but in each case, it came up with some recommendations that I hadn't thought about. So it's worth going through that. And one of the things that's important for all of us to know is even if we might have, adequate incomes, we might have family members or friends that don't. And so being able to successfully help them get help is a really good thing to do. Then we've got here's the senior health insurance program that I mentioned a minute ago. And that is a program that is staffed by volunteers, and they get special training through the state on how to assist seniors in enrolling for healthcare services. In DuPage County Senior Services provides that through their staff. And then many of the individual townships and villages also have SHIP counseling available. And in fact, I looked at it and there were dozens of them. The township, the village where I live, the township where I live, established and well-developed program, and I've heard good things about it. In Kane County, there's a number of places as well. The directory is on coming back here, the Illinois Department on Aging SHIP website has a directory there. And then this resource here that I'm pointing to right now with my cursor is the Chicago area premium comparison guide. So you can also find that on the Department on Aging website, and you can look and see what the premiums for the various Medicare supplements are going to be.